Assalamualaikum, Chapter 36, Skin Integrity and Wound Care, presented by me, Rangaig Ana Farina M. Let us first define skin. The skin is the largest organ in the body and serves a variety of important functions in maintaining health and protecting the individual from injury. Impaired skin integrity is not a frequent problem for most healthy people but is a threat to older people, to clients with restricted mobility, chronic illnesses, or trauma, and those undergoing invasive healthcare procedures. So we all know skin, we all have that. So let's proceed to the next slide. Intact skin refers to the presence of normal skin and the skin layers uninterrupted by wounds. The appearance of the skin and skin integrity are influenced by internal factors such as genetics, age, and the underlying health of the individuals, as well as internal factors such as activity. Next slide. So, a wound in Tagalog is sugat. So, disruption in the continuity of cells. Wound healing is the restoration of that continuity. The wound is open when the skin or mucous membrane surface is broken. Effects of wound. First, loss of all or part of organ functioning, sympathetic stress response, hemorrhage and blood clotting, bacterial contamination. Lastly, death of cells. So those are the effects of wound. So let's proceed to each types. Types of wounds. Body wounds are either intentional or unintentional. Intentional trauma occurs during therapy. Example, operations or venipuncture, removing tumor. And unintentional wounds are accidental. Example, a person may fracture an arm in an automobile collision. If the tissues are traumatized without a break in the skin, the wound is closed. The wound is open when the skin or mucous membrane surface is broken. So, intentional wound, yun nga, pag sinasadya na magkasugat, pag intentionally causing a wound like operation, surgery, or as such. An unintentional wound is an accident or accidental having a wound. Wounds may be described according to how they are acquired. Incision wounds, sharp instrument. This is an open, deep, or shallow wounds. Under the incision wounds are contusion wounds, blow from a blunt instrument. A closed skin appears ecchymosed or bruised. Second, puncture wounds, penetration of the skin and often the underlying tissues by a sharp instrument, either intentional or unintentional. This is an open wounds. Third, lacerated wounds, tissue torn apart, often from accident. This is an open, edges are often jagged. Fourth, abrasion wounds, surface scrape. This is an open involving the skin. Lastly, penetrating wounds, penetrating the skin and underlying tissues, an open wound. So let me show you these different kinds of wounds. The first picture shows the lacerated wound, which is an open wound. The edges are often jagged. The second picture, as you can see, it involves the skin, which is the abrasion wounds, an open wound involving the skin. And lastly, the last picture on the side, it is the penetrating wounds. It penetrates the skin and underlying tissues. Obviously, it is an open wound. So these are the different phases of wounds. So let's proceed to the types of wounds according to degree of wound contamination. First one, clean wounds, uninfected wounds in which minimal inflammation is encountered. Second, clean contaminated wounds, surgical wounds in which the respiratory, alimentary, genital, or urinary tract has been entered, no evidence of infection. Third, contaminated wounds, unopened, fresh, accidental wounds and surgical wounds involving a major break in sterile technique or a large amount of spoilage from the gastrointestinal tract show evidence of inflammation. So this is either intentional or unintentional wound. Lastly, the worst one, dirty or infected wounds containing dead tissue and wounds with evidence of a clinical infection such as purulent drainage. So let's proceed to pressure ulcer. So pressure ulcers were previously called decubitus ulcers, sores, or bed sores. It is only lesions caused by unrelieved pressure that result in damage to underlying tissues. This is an injury to skin and underlying tissue resulting from prolonged pressure on the skin. So, etiology of pressure ulcers. Pressure ulcers are due to localized ischemia, a deficiency in the blood supply to the tissue. The tissue is compressed between two hard surfaces, usually the surface between the bed and the skeleton. When the blood cannot reach the tissue, the cells are deprived of oxygen and nutrients. Waste product of metabolism accumulate in the cells, and the tissue subsequently dies. Prolonged, unrelieved pressure also damages the small blood vessels. As you can see in the picture below, it shows the stage 3 pressure ulcer. Risk factors, friction and shearing. Two other factors frequently act in conjunction with pressure to produce pressure ulcers. First, friction. Friction is a force acting parallel to the skin surface, such as sheets rubbing against skin create friction. Friction can abrade the skin, that is, remove the superficial layers, making it more prone to break down. So let's move to the second one, which is the shearing force. Combination of friction and pressure, it occurs commonly when the client assumes a faller's position. So in this position, the body tends to slide downward toward the foot of the bed. This downward movement is transmitted to the sacral, bone, and deep tissues. At the same time, the skin over the sacrum tends not to move because of the adherence between the skin and the bed linens. The skin and superficial tissues are thus relatively unmoving in relation to the bed surface, whereas the deeper tissues are firmly attached to the skeleton and move downward. So this causes a shearing force in the area where the deeper tissues and the superficial tissues meet. So the force damages the blood vessels and tissues in this area. So as you can see in the picture below, shearing forces can occur when a patient is moved carelessly and slides down in bed. So the patient's position can really affect the patient's condition. Third one, immobility, refers to a reduction in the amount and control of movement a person has, such as paralysis, extreme weakness, and pain. Fourth one, inadequate nutrition. It causes weight loss, muscle atrophy, and loss of subcutaneous tissue. These three reduce the padding between the skin and the bones, most specifically inadequate intake of protein, carbohydrates, fluids, and vitamin C. Fecal and urinary incontinence. Moisture from incontinence promotes skin maceration. Digestive enzymes in feces contribute in excretion, which cause irritation to skin and harbor microorganisms. Next one, decreased mental status. Individual with a reduced level of awareness, for example, unconscious or heavily sedated, they are less able to organize and respond to pain associated to prolonged pressure. Diminished sensation. Paralysis, stroke, loss of consciousness may cause loss of sensation in a body area. Loss of sensations reduce a person's ability to respond to trauma, to injuries, heat and cold, and to tingling that signals loss of circulation. Sensory loss also impairs the body's ability to recognize and provide healing mechanism for a wound. Excessive body heat, increased body temperature, increased metabolism, increased cell need for oxygen. Next one, advanced age, due to changes in body mechanisms such as a loss of lean body mass, decreased strength and elasticity, diminished pain perception, increased dryness due to a decrease in the amount of oil produced by the sebaceous. And chronic medical conditions. Cardiovascular diseases are risk for skin breakdown and delayed healing. These conditions compromise oxygen delivery to tissues by poor perfusion and thus cause poor and delayed healing and increased risk of pressure sores. And there are other factors like poor lifting techniques, incorrect positioning, repeating injection at the same area, and correct application of pressure relieving devices. So those are the risk factors of a wound. Let's proceed to stages of pressure ulcers. So stage 1, As you can see, red color and the skin don't return to normal color, even the pressure is released. When we say stage 1, it is in less risk of a pressure ulcer. Stage 2, redness accompanied by blisters or shallow break in the skin. As you can see in the picture below, it has the accompanied by blisters or shallow break in the skin. So stage 3, break in the skin extending to the subcutaneous tissue. So there the picture of stage 3. Yes, and stage 4 ulcer involves loss of all skin layers, exposing muscle and bone. So in this stage, there is an exposure of muscle and bone. So it is the worst stage in pressure ulcer. Risk assessment tools. Several risk assessment tools are available that provide the nurse with systematic means of identifying clients at high risk for pressure ulcers. Braden scale for predicting pressure sore risk, and the Norton's pressure area risk assessment form scale. So there's the picture of the Braden scale for predicting pressure sore risk and the Norton's pressure area risk assessment form scale. So those are the tools that are available to provide the nurse to identify the clients at high risk of pressure ulcers. So wound healing. Healing is a quality of living tissue. It is also referred to as regeneration or renewal of tissues. Healing can be considered in terms of types of healing and phases of healing. So, types of wound healing. There are two types of healing influenced by the amount of tissues lost. First, primary intention healing occurs where the tissue surfaces have been approximated or closed and there is minimal or no tissue loss. It is characterized by the formation of minimal granulation tissue and scarring. It is also called a primary union or first intention healing. Example, closed surgical incision. Second, secondary intention healing. It is intensive and involves considerable tissue loss and in which the edges cannot or should not be approximated. For example, pressure ulcer. Secondary intention healing differs from primary intention healing in three ways. First, the repair time is longer. Second, scarring is greater. Susceptibility to infection is greater. Phases of wound healing. Inflammatory phase is initiated immediately after injury and lasts 3 to 6 days. Two major processes occur during this phase. First, the hemostasis and phagocytosis. Hemostasis is the cessation of bleeding and the cellular debris by a process is the phagocytosis. Proliferative phase extends from day 3 or 4 to about day 21 post-injury. And lastly, maturation or remodeling phase begins about day 21 and can extend 1 or 2 years after the injury. During maturation, the wound is remodeled and contracted. The scar becomes stronger but the repaired area is never as strong as the original tissue. So let us proceed to types of wound exudate. Exudate is material such as fluid and cells that has escaped from blood vessels during the inflammatory process is deposited in tissue or on tissue surfaces. So there are three major types of exudates. The serous exudate, purulent exudate, and the sanguineous exudate or the hemorrhagic. So there are also mixed types of exudates like serosanguineous consisting of clear and blood-tainted drainage and the purosanguineous consisting of pus and blood. So there are the types of exudates. So, publication of wound healing. So first, hemorrhage. Hemorrhage is abnormal massive bleeding. Internal hemorrhage may be detected by swelling or distension in the wound. And second is infection. Infection, the main important area of prevention lies on aseptic techniques in wound care. Cleanliness and environmental disinfection are important. And last, the dehiscence with possible evisceration. So dehiscence, a partial or total rupturing of sutured wound, and evisceration, the protrusion of the internal viscera through the incision area. Factors affecting wound healing: development consideration, nutrition, wound condition, lifestyle, and medications. Nursing management. First, assessing. Under the assessing is the assessment of skin integrity, nursing history, and physical assessment. Assessment of wounds. Under the assessment of wounds is the ARIDA, untreated wounds, treated wounds, pressure ulcers, laboratory data. And second of nursing management is diagnosing, third, planning, fourth, implementing. Nursing intervention for maintaining skin integrity in wound care involve supporting wound healing, preventing pressure ulcers, treating pressure ulcers, dressing and cleaning wounds, supporting and immobilizing wounds, heat and cold applications. Nursing intervention for maintaining skin integrity in wound care involve, under the supporting wound healing are moist wound healing, nutrition and fluids, preventing infection, and positioning. Under the preventing nutrition are maintaining skin hygiene, avoiding skin trauma, providing supportive devices, and treating pressure ulcers. Under it, the RYB color code, R stand for red, are usually in the late generation phase of tissue repair. Y stand for yellow. Wounds are characterized by liquid to semi-liquid that is often accompanied by purulent drainage or previous infection. Black, wounds are covered with thick necrotic tissue. So, this picture below shows on how to use the universal wound or incision. So that is how to dress it in different parts of your body that have wounds. Debridement may be achieved in 4 different ways. Sharp debridement, a scalpel or scissors is used to separate and remove dead tissues. Mechanical debridement through scrubbing force or moist to moist dressings. Chemical debridement, collagenase, enzymes, agents such as papain, urea. Autolytic debridement, dressing that contain wound moisture such as hydrocolloid and clear absorbent dressings. So fourth, under the nursing intervention is the dressing wounds. So types of dressings. So there are types of dressings used depends on location, size, type of the wound, amount of exudate, whether the wound requires debridement or is infected, frequency, ease of difficulty of dressing, application, and cost. Fifth, under the nursing intervention, the cleaning wounds. Wound cleaning involves the removal of debris like foreign materials, necrotic tissue, and bacteria, wound irrigation, and packing. Sixth, supporting and immobilizing wounds. Bandages, a strip of cloth used to wrap some part of the body. Binders is a type of bandage designed for a specific body part. Bandages and binders serve various purposes. First, support a wound, immobilizing a wound, applying pressure, securing a dressing, retaining warmth. So I will show you a common bandaging methods. So there are the pictures of bandaging methods in different parts of the body. So yes. Seventh, under the nursing intervention, heat and cold applications. Heat and cold are applied for systemic and local effects. Local effects of heat, sedative effect to relieve pain and aches, vasodilatation and increased blood flow to the affected area, bringing oxygen and nutrients, antibodies and leukocytes, promotes soft tissue healing, and it is often used for clients with musculoskeletal problems such as arthritis. Disadvantages: increased capillary permeability which cause edema. Local effects of cold: vasoconstriction, which decrease the blood supply and nutrients to the affected area, decrease cellular metabolism, decrease removal of waste, prolonged exposure to cold results in impaired circulation, cell deprivation, and subsequent cell damage. Advantages: slow bacterial growth, decreased inflammation, local anesthetic effect. Systemic effects of cold and heat. Heat applied to a localized body area or large body area. It may cause excessive vasodilatation, drop in blood pressure, fainting, especially for those with pulmonary and cardiac problems. Cold application causes vasoconstriction, increase in blood pressure. Shivering is the body response to cold. And finally, the last topic of my report, for all local applications of heat and cold, the nurse need to follow these guidelines. client's ability to tolerate the therapy, contraindication of treatment such as bleeding, explain the application to client, assess skin area, ask the client to report any discomfort, return to the client after 15 minutes, remove the equipment at the designed time, examine the area, and record the result. So that is all for my topic for Chapter 36, Skin Integrity and Wound Care. Once again, I am Ana Farina Rangaig. Thank you for listening.